So just moving on now, and I'd love to introduce our non-medical speaker for the night, Miss Linda Howe. By occupation, Linda is a workplace investigator. She's also completing her PhD at the moment. She's a proud mum of two beautiful little boys, and Linda was diagnosed with breast cancer, and that diagnosis was delayed by 5 months due to her symptoms being overlooked as a pregnancy symptom. Linda set out then to start the BEAT movement to spread awareness about breast cancer in young women so that the next generation of young women will have a better chance of catching their cancer early and have more support in balancing cancer treatment and motherhood. So she's going to speak to us tonight about her movement and about breast cancer in pregnant and breastfeeding young women, and we're delighted to have you here, Linda.
Hello, good evening. Thank you so much for the opportunity to come and speak with you all tonight, and for us to be able to share our stories with you. Sorry about the cough, not contagious. As I mentioned, my name is Linda and I'm the founder of a little project called the BEAT Movement. And the goal is basically to spread awareness around breast cancer in young women, especially in and around pregnancy. This time last year, I could have probably told you a whole heap of useless facts that were probably very incorrect on breast cancer and why I was not at risk, because, I don't know, just didn't think that I was. Sorry, you have to excuse my nervous.
Just breathe.
Breathe. Okay, here we are. But I think what the last year has taught me is that there are so many other people out there like me who have that same naive understanding of our actual risk at this age, and especially around pregnancy. So I do truly hope that the BEAT movement will help shift the way that people think, both from a community perspective, so that we know ourselves, but also from a clinical perspective on how midwives and doctors respond when a patient actually raises a concern like a breast lump. Okay, this is just a couple of girls from Adelaide. You can have a little look at their ages. So it's, certainly doesn't discriminate, and you'll see that around the age that you're sort of looking to have children, it's actually reasonably common. I guess, when you find out you're pregnant, it's a happy time. And then you meet your tiny little human. But for about 1 in 1,000 pregnancies, that's the stats that I've found anyway, I guess life turns upside down a little bit. So all these, oh my gosh, excuse the emotions, all these young women were diagnosed, oh my gosh, this is ridiculous, during or around pregnancy. Okay, sorry. So with 1 in 7 women in Australia likely to develop breast cancer in their lifetime, and about 6% of those being in women under the age of 40, it is definitely something that needs to be spoken about, and definitely something that needs to be in the back of everyone's mind when they're treating patients. Sorry, I've got a lot of cancer-related stuff going on right now. Okay, so I just want to share a little bit about my story. This time last year, I was about 30 weeks pregnant, and I woke up one day and I found this tiny little tic-tac, thank you, I'm all good. I just, this whole process has just made me so emotional, and I have no nose hair from the chemo, so, oh my gosh. I'm just going to be really raw and honest with you all. So I found a little tic-tac type lump, and it was right there. And I raised my concerns with my midwife because my midwife was my primary health care professional at the time, and so that was what I thought was the right thing to do. And she innocently just told me, look, it's a blocked milk duct. Nothing to be terribly concerned, just massage it, pop heat on it. But that just didn't sort of sit right with me. So I continued to raise my concerns around the lump at every subsequent appointment, and my midwife ended up unwell, and so I started seeing a lot of random people after that. I'm not a doctor, not a medical doctor anyway, and so I just trusted what I was being told. If I was being told it was a blocked milk duct, then indeed it just must be a blocked milk duct. On November the 30th, I had my little boy Eli. While I was in the hospital, I noticed that the lump was still there, despite sort of what they'd said is basically it might go away, once you start breastfeeding, and it just still hadn't. So I continued to raise the concerns. Everyone who came in my room, I'm like, hey, I got this lump, won't go away. And one doctor actually said, oh, do you have any family history of breast cancer? And I'm like, nah, no family history. And then he just went straight back to it being a blocked milk duct again. I'm like, okay, well, it's a really stubborn one. In January, I finally saw my usual GP for my little boy's 6-week checkup, and I asked her if I could just have a quick chat with her because this lump was still annoying me, and I actually had a blood clot come out when I was feeding my little boy. And as soon as I showed her, she just immediately referred me to a breast specialist because she happened to have someone who's now one of my friends, another young woman who is one of her patients had the exact same thing. So sure enough, a few weeks later, got my breast cancer diagnosis. It was pretty tough. You can see from the photos up here, it went from, being all, expecting a baby to better take a photo before I lose my hair to shaving it all off. This is a wig, by the way. Not real. So since then I've had 16 rounds of chemo. I've had more tests and scans that you could poke a stick at, believe me. Had a double mastectomy last week. Now remember how I said that I didn't have any family history? Well, we don't have a single breast or ovarian cancer or any of the other associated cancers, like the hereditary ones on either side of my family. So anytime I've been asked that, I've always confidently said, no family history. But when you're this age and you get this sort of diagnosis, they automatically put you through for genetic testing, and sure enough, I have a BRCA1 mutation. So keeping in mind that less than 10% of breast cancers are hereditary, just in your clinical time with your patients, just I guess don't ever assume that it's not a breast cancer just because they don't have any family history, because I would have said that I didn't, even though I still had a BRCA gene. Now I definitely don't blame my care team for telling me I had a blocked milk duct for 5 months. If they've never seen a young pregnant woman with breast cancer before, it's definitely an easy oversight. But what it does tell me is where change is needed, because I guess my story has been the story of so many women over the last 50 years and really not much has changed. Sorry, so it's down nose hairs again. My care team probably still have no idea what happened to me. However, I hope that enough midwives and doctors can actually hear my story and the story of all the other young women to make them better clinicians and help more young women actually get an early diagnosis, because that can be the difference between cure and whether it can be managed or not. So before I blubber on too much more, I would just like to pass over to Catherine
so far, listeners. Yeah, I've had the luxury of time to not feel so emotional about what's going on with me, because I'm 41 years old. As you can probably tell, I'm not a local. I'm from Northern Ireland. I moved here when I was 28. I had my first child, Lily, when I was almost 31, and then 3 years later had Anna, who's now 7. So I was 34 when I had her. And it was 3 months after she was born that I woke up one morning and just in the shower thought, hold on, I think there might be a lump in my breast, but it was so vague, I wasn't sure. I got my husband to have a little feel and he was like, nah, I think there is a lump. Went to see my GP that day. She gave me a script for antibiotics in case it was mastitis, but also gave me a referral for an ultrasound. 5 days, no change, go get an ultrasound. And I went in 5 days and I had a radiologist come in and scan my armpit and the floor just fell out from underneath me. And the next day, I went to see the surgeon, and by the end of the week, I was told I had breast cancer and I had both of my breasts removed. And as it turned out, it was metastatic breast cancer. So I had tumours in my spine and my sternum, and I was very lucky because we do have really amazing treatments these days, and I had Herceptin, which is a targeted treatment. And I'm pretty sure that it was it, as well as all the chemo and everything else, but it cleared up my breast cancer. I had no evidence of disease until 2 years ago. And then it came back with a vengeance, and I now have lung metastases, and I have been moving from one treatment to the next. I'm now on my last option, so I started that a few months ago. It is working. Hopefully it stays working for a long time, but my future is looking a lot shorter than I would have hoped for back at the age of 34 whenever I had Anna, and I was just in baby bliss, and it was, second time round, it was easier until all this happened. And it was such a shock. It was just, of course it's a shock, but also I'm very health conscious. So I've cycled to work for the last 12, 13 years. I ate healthy. I've always looked after my teeth. I was probably having cervical smears before I needed them. But the fact is, growing up in Northern Ireland as a young woman, it was just never on my radar that I might be at risk of breast cancer. And coming here as well, exactly the same. And I never knew actually that I could just go to a GP and have a breast check. I just always felt that everything was directed at those women over 50, 55 who need to go for a mammogram, and the rest of us were just kind of forgotten about. And my obstetrician actually was very thorough with both children about making sure that I had had a cervical smear at my 6-week postnatal visit if I was due one. And I've often thought back and thought, if only I'd had a breast screen at that point as well, I might be standing here today saying I'm cured of cancer and hopefully I have a really long future, and that's actually not what's going to happen at all. So I guess, there's a number of things. I know most of you here are midwives, so I guess I was trying to think, what symptoms did I have in hindsight which might have been picked up earlier? And actually there were probably quite a lot of things, but I think in the context of pregnancy and breasts being a bit weird, and our bodies aren't perfectly symmetrical either, it was easy, a bit like Linda situation, to just go, oh, that's just because I'm pregnant. But most definitely by the week I was diagnosed, there was much less milk getting produced out of the side that was affected by the cancer. But I suspect that actually had been the way it was from the start. So whenever I was in hospital after she was born, just before my milk came in, I think my nipples were getting really, really painful, and I just said, I want to just pump for a bit just to give them a rest. And I'm pretty sure that nothing came out really from one side. And then some did come out from the other, but I think it didn't go into Anna's mouth properly. Anyway, the midwife said to me, I think we're just going to have to give her some formula. She's going to be hungry otherwise. And that was fine. Then my milk came in, and then it all kind of got forgotten about. But I'm pretty sure that the whole way along there was one side that there was less milk coming out of, and it became very obvious, I think, that week that I got diagnosed, and I didn't even want to feed from that side either. I also suspect that that breast was heavier, so even though it wasn't producing much milk or as much milk, I think it was probably always a bit heavier and felt fuller. And I suspect, I mean, it's 7 years ago, so it's hard to just exactly think, but I suspect that even when I was pregnant, there might have been some discharge from the nipples, and I'm feeling, I mean, again, that probably happens normally, but I suspect that there might have been slightly different color discharge coming out of the affected side. So I guess what I, urge all of you to do is think about, for example, at that 6-week appointment or during pregnancy, or just when the mother has been in hospital and the child has been born, look out for these little abnormalities. And yes, they might be just because you're pregnant and weird things happen and you're not perfectly symmetrical in your bodies, but it's worth asking those questions. Is there a family history? That might, as we know, that's not the be all and end all, and I had no family history. I'm from a big Irish family. My parents are both one of 7, and I have one grandfather who has had a brain tumor, and that's it. So there's very little cancer in our family. But it's a point to just go, hold on, let's just follow this up. Let's err on the side of caution. Let's ask some more questions, perhaps suggest going for a breast check. We do now know there's substantial evidence to show that the risk of breast cancer does increase after pregnancy. It peaks about 5 years after the birth, and it continues on for about 24 years, and it tends to increase with the age of the female as well. So there's some very substantial data to back that up. So just when you see those little abnormalities, just don't just leave it at that. Follow it up. And also, to just put this in context, I said about the cervical screen, the incidence of cervical cancer in Australia last year was 8.7 per 100,000. The incidence, and that's in the 20 to 39 year age group. In the same age group, the incidence of breast cancer was 26 per 100,000. So we are very good at making sure people have cervical screens. Maybe it's time that we actually made sure people check their breasts after pregnancy and are aware that there is a period, particularly in that 5 to 10 year period after the birth, that there's actually an increased risk of breast cancer compared to women who haven't had children. Thank you very much. I'm going to hand over to Emma.
I'm going to read from a speech because I'm not very good at speaking off the top of my head, so we'll go from there. So I'm just going to read it as it happened. So it was February 2020, and I was 44 years old when I first felt a very unusual lump in my right breast. I'd actually just experienced a miscarriage at 7 weeks gestation, and I had a pelvic ultrasound performed earlier that week to confirm that it was a complete miscarriage. And I had a GP appointment booked in that same week to get the results. It was at this GP appointment that I mentioned the unusual lump in my right breast. It was actually it actually had like a rope sort of texture to it. It was kind of 3 lumps in a row. It was very unusual. And I asked the doctor if I should be concerned. The GP's response was that it would just be a hormonal reaction to my miscarriage and it should settle down in the coming weeks. He could see that I still felt concerned, and then he went on to say that I can give you a referral if you like, but it's probably nothing. It was at this point that I chose to trust that advice and accept that the lump was simply a hormonal response to my miscarriage, and I declined to proceed any further with a breast ultrasound referral for me. My partner was very uncomfortable with this at the time, but I reassured him with what the GP had said, and I said I'd already had a history of benign breast lumps. I actually had 2 biopsies and lumpectomies in my 20s and 30s, and so I was sure that I'll be fine. It was 2 months later that I was fortunate enough to fall pregnant again with my now 18-month-old daughter. As it does, my body shape changed rapidly during that first trimester, and my breast had noticeably enlarged, and there was no evidence of any lump in that right breast anymore to touch. This increased my confidence that the GP was right all along, and the lump had been nothing to be concerned about. Despite being 45 years of age, my pregnancy was otherwise very straightforward, and I was looking forward to our planned second home birth as I had done with my first child. I had chosen to have private midwifery care as the hospital system at that time didn't support me in my choice of birthing at home. Towards the end of my third trimester, at around 36 weeks, the lump in my right breast had become noticeable again. This time I was seeing a female GP from the same practice as my original GP had moved interstate. I mentioned to her that the lump had returned and asked whether or not I should be concerned. The GP told me that while it was probably nothing, the current guidelines state that any breast lump should be given a referral for an ultrasound and a fine needle biopsy, as unfortunately breast cancer can be diagnosed at any age. I think it was at this point that I went into some form of shock. And I guess on reflection, if I'd been given that information after my miscarriage, I would have acted on it. I think that's what's crucial with the timing of this information. Because at this point I was 36 weeks pregnant, I was preparing for my upcoming labour and birth, and I simply did not have the capacity to consider the possibility of a breast cancer diagnosis. So I went into some form of denial. I told the GP that I had breastfed my first child until he was 3 years old. I couldn't possibly have breast cancer. I was vegetarian and I exercised regularly. I was hardly in the running for a cancer diagnosis. So I simply took the ultrasound referral and told my GP that I would have the ultrasound done after birth as a precautionary measure. So at 39 weeks gestation, I had a wonderful and straightforward home birth as planned. My daughter Audrey was born in 45 minutes on the bathroom floor before the midwife even had a chance to walk through my front door. My partner and son didn't have time to finish filling the birthing pool before she was born, and so we went in afterwards, and it was a beautiful bonding experience for my family. I did have some initial difficulty with a diagnosed tongue tie with breastfeeding, but that was very quickly revised by an oral surgeon, and breastfeeding became as easy and nurturing as it had been with my son, who is 8 years older. My daughter was thriving, and we were simply adjusting to having a newborn baby in the house again. By 10 weeks postpartum, my partner reminded me that I still hadn't been for that breast ultrasound, and so I booked it in to have it done that week. When I went to the ultrasound appointment, I was feeling confident that everything would be straightforward and routine. It was during that ultrasound that everything began to change. The radiographer told me that the ultrasound had some unusual features and a fine needle biopsy would definitely be required. They told me the results would be available the following day, and a phone call from my GP confirmed my worst fear, that I did have breast cancer, and that's when the whirlwind began. I had a mammogram and punch biopsy the following week and an appointment with the breast and endocrine unit at Flinders Medical Centre just to get those results. The news was devastating. I had estrogen and progesterone positive breast cancer, and given the size of the tumour, my right breast had to be completely removed. I couldn't believe what I was hearing. Here comes the emotion. And then the next blow, which for me was a big one, which doesn't really compare with mortality, but I was told that I had to stop breastfeeding completely to prepare for the surgery and the treatment that I would need afterwards. My daughter was now 12 weeks old and exclusively breastfed. I had breastfed my son into toddlerhood, and I planned to give my daughter that same start in life. I personally had been working as a lactation consultant and a clinical nurse with SA Health for the last 14 years, and I had been passionate about the importance of breastfeeding both professionally and with my own children. And so at this point I was completely and utterly devastated by that. Within 2 more weeks, I had had a double mastectomy performed at Flinders Medical Centre, and my breastfeeding journey with my daughter was permanently over. The results from the surgery confirmed the original diagnosis. I had a 60mm tumour in the right breast. It was estrogen and progesterone positive, and now I had 7 positive lymph nodes. I was officially diagnosed with stage 3, grade 3 breast cancer, and just with chatting with Catherine and Linda tonight, I realised that from the time I first raised the breast lump with my GP to the time of diagnosis was actually a period of 14 months. The following weeks were a blur of appointments and treatment decisions. I committed to a 5-week course of radiotherapy, but I was unfortunately unable to go through the chemotherapy option because of a pre-existing bone marrow disorder that made it too risky for the transformation into acute myeloid leukemia. I attempted to take the estrogen blocking medication tamoxifen, but the side effects of extreme brain fog and uncontrolled vaginal bleeding were too much for me to deal with everything else that was going on. As you know, once the cancer has left the breast and entered the lymph nodes, the prognosis is much more bleak. I've been told from a statistical perspective that I have a 12% chance of still being alive in 10 years' time. But however, I was also told that I had a 1.6% chance of conceiving naturally at the age of 44, and I managed to do that despite the odds. So I'm determined not to be a statistic once again. So here I stand 17 months from that first horrific diagnosis, and I'm now partway through my breast reconstruction, which for me is a very important part of my psychological healing. So what have I learned from this experience? It's that every breast lump must be investigated further. Regardless of the history, regardless of the circumstances, every breast lump is a potential breast cancer. No one is too young, and breast lumps during pregnancy and breastfeeding cannot always be explained by hormonal changes or mastitis. If you ever come across a woman in your care who mentions that she has found a breast lump, please tell her that it is essential that she is investigated further and to be clear on what the cause actually is. You could be saving someone's life in the process. And thank you for listening.
I just have a couple more things. So glad you got some tears up there, Emma. Made me feel a bit better. So obviously you can see it's obviously this has changed our lives. No one wants to hear it, and no one wants to hear it when they're trying to raise young children either. Personally, my little boy is now 9 months old, and I also have a 3-year-old. So yeah, like it's tough. But at least we're getting on top of it at the moment. My advice to the clinicians out there is to respond to concerns as if the concern was happening outside of pregnancy. So for example, if someone presented to you with a lump and they weren't pregnant, would you investigate it? What would you do? Would you send them for an ultrasound and a biopsy? If that's what you would do, if they weren't pregnant, well then please do that if they are pregnant, because, while most of the time maybe it is a blocked duct, for people like us, it hasn't been. And I just know that there's more women out there that are probably having the same experience. Also having like a bit of a 2-week follow-up. So, patient comes in and says, hey, I've got a breast lump, case note it, check back in 2 weeks. Hey, is that breast lump resolved? Is it still there? And then know that there are more things that you can do, more referrals, refer them to their GP if you have to, refer them to a specialist, get an ultrasound, whatever's in your capacity to do, just do something, because it's better than doing nothing. We would also love to see a doctor-assisted breast check included in the current pregnancy care model. I actually feel like the more women I talk to that are in my situation, the more that actually could have saved their lives and got them an earlier diagnosis. So basically, I hope that our stories will stick with you. And if you do ever have a patient that described any potential cancer symptom like what we've mentioned today, that our stories will encourage you to direct them to where they need to be to get that diagnosis, I guess. You guys do an amazing job, but it's that little bit more difference that you can make in a young woman's life if you take those steps. So thank you.